Those who have a why to live can bear almost every how. This quote from Viktor Frankl, psychiatrist and Holocaust survivor, is something that's been on my mind a lot during the past year of this pandemic. As someone from a large, close-knit family who struggled in the past with depression, those first few weeks of isolation at the start of the pandemic really took a toll on me. But from my research and from research for years before me, I knew that in times of adversity and stress, when enjoyment is hard to find, deeper meaning is the key to coping. And so I endeavored to find meaning in spite of and because of the pandemic, because I knew this is what would get me through emotionally. For many people at the start of the pandemic, our dining tables became home offices, but for me, half of my table transformed into a sewing studio. Whenever I felt hopeless, I would cut out my cotton pieces and start sewing them into masks. Sewing masks transformed my despair into purpose. When I would hear the clicking sound of my sewing machine and the louder buzz of my serger from my abuelita, it reminded me of my childhood memories of my grandmother teaching my sister and me how to sew. And so in those moments, when I thought about them, I felt more connected to them, even in the isolation of my home. Those moments when I was handing bags of masks to essential healthcare workers, I again felt connected to others, even through the plastic shield between us. The more masks I made, the more meaning I had, and the more my depression was slipping away. By May, the pandemic was still happening. Things still weren't as fun or enjoyable as before. But as I found meaning in more and more ways, my mood really changed at that time. Helping our Psychological Services Center on the campus at the University of Mississippi transform into using telehealth services was something that gave me the motivation to get up in the morning on days when I just wanted to sleep my reality away. And so when the opportunity came my way to research pandemic resilience, I knew that this was exactly the kind of thing that would give me a why to live. In my research over the past few years, before the pandemic, I had already been looking at this interconnection between resilience, meaning in life, and disaster prevention and preparedness behaviors. And so what I found was that my own personal experience with the pandemic was mirroring the research that I had been doing. When I say psychological resilience, I don't mean that the pandemic didn't have an emotional effect on me. It did. What I mean by resilience is finding ways to cope so that we get back to typical functioning even after adversity, stress, and trauma. I love to use this picture of this tree as a metaphor for resilience because it acknowledges that trauma has an effect on us. We get hit pretty hard sometimes, but we find a way to hold on, endure, and bounce back. And resilience is more common than you may think. Over 60% of people will experience a traumatic event in their lifetime, yet less than 10% of them go on to develop PTSD. And in Mississippi specifically, because Mississippi has a long history of racial violence and trauma, Mississippi has a long history of resilience. Civil rights movement activist and leader James Farmer Jr. was heavily involved in desegregating public transportation in the 1960s. And in the 1980s, he said that he was scared all of the time back in the 60s. He said, courage is not being unafraid, but doing what needs to be done in spite of fear. And I think his words and his actions are a really powerful example of what I mean by this interconnection between resilience, meaning in life, and taking action. Resilience isn't coping through denial, but coping by finding meaningful ways to actually do something to directly address the problems and horrible things going on in your life and in your world. And some of the research that I've been doing in natural disasters, and more recently the pandemic, what we've seen is that people who have a greater sense of meaning in life find meaning in engaging in these prevention and preparedness behaviors. And those are the people who are most psychologically resilient, whose mental health is best when they experience a trauma or stress like a disaster. So some of the studies that we've been doing have looked at what it takes to get people to be engaging in more prevention, preparedness behaviors for disasters, and more recently, pandemics. And with natural disasters and incidents of mass violence, what we've found is that there are two key things that help people be more prepared: threat perception and self-efficacy. So threat perception means that you believe that a disaster is likely to occur, and it's likely to cause problems when it does. It's likely to cause harm and damage. Self-efficacy means you have confidence that if and when a disaster does occur, you can take action to do something to reduce the harm that is done. Now, since tornadoes are common in Mississippi, and that's one of the disasters that I've researched, let's use the example of a tornado. If you have high threat perception, then you're aware that tornadoes happen multiple times a year in North Mississippi, and they cause a lot of damage and can hurt people when they happen. If you have low self-efficacy, then you think there's not much of anything at all that you can do about this. And the result is that you end up feeling afraid. And instead of trying to do something to address the threat directly, you try to address your fear. You try to take action to reduce your fear. And oftentimes what that looks like is coping with denial, trying to minimize the threat, trying to think about it differently rather than trying to do something about the problem. And so, contrary to popular belief, what my research has found is that fear is actually negatively related to being more prepared and taking more prevention actions for disasters. People who are more afraid are actually less likely to be prepared and taking those prevention actions. Instead, it's the people who have accurate threat perception and also high self-efficacy. They believe that there are things that they can actually do to make a difference. Now, I don't mean by self-efficacy that people think that they're superheroes who could make tornadoes go away. I mean having confidence that even when this does happen, you can do something to reduce the amount of harm done. And so in our studies, what we found was, for example, that people with higher threat perception and higher self-efficacy were more likely to know what to do when the sirens go off on campus, or know where to go in the buildings that they frequent when those sirens go off. One of the cool things that has come out of doing this research has been that we've been able to share our findings with university emergency management, and they've actually used these ideas to change the way they try to educate people on disaster preparedness. So this flyer in the red box is an example of one of the newer ways that they're presenting this information that has more of a self-efficacy message instead of the fear-based message that they were using before. So in the research on natural disasters and incidents of mass violence, it's clear that threat perception and self-efficacy are key for people to be more prepared. But pandemics are a bit different because each of our individual actions affects other people so much. Pandemic prevention requires much more cooperation, much more working together. Or as you can see in these pictures, for example, my family working together amongst ourselves and with the nursing home where my grandparents live in order to modify our behavior and find safer ways to interact with my family, with my grandparents during the COVID-19 pandemic. So from May 2020 to October 2020, our research team at the Clinical Disaster Research Center surveyed international students and their partners who were quarantined in Mississippi. And what we found was that it isn't self-efficacy that predicted pandemic prevention behaviors. It was collective efficacy. Collective efficacy means you have confidence that your whole community working together can do things to improve the circumstances of the group, of the community as a whole, not just your circumstances individually. And so it was collective efficacy and accurate threat perception, again, that best predicted students doing a better job of pandemic prevention behaviors. And this would change from week to week. The weeks that people had a greater sense of collective efficacy, that's when they're doing a better job with things like social distancing. Now, if you're someone who's been taking these pandemic prevention precautions over the past year, it's possible that people have accused you of living in fear. And if someone is saying it that way, then that probably means that when they receive information about the threat and danger of COVID-19, they don't have much confidence that they or their community can do anything about it. And so they're trying to cope with their fear by minimizing the threat. And I would encourage you not to think about things in this way. There is another way. when you are faced with and aware of the dangers of this threat or of future disasters, focus instead on what it is that you can do individually and what your community can do together to actually reduce the harmful effects of the pandemic, disaster, or other threat. And so what our research has shown is that it's when people have this higher efficacy, they're engaging in more prevention and preparedness behaviors. And those are the people who have better mental health during and after disasters. So the key takeaway here is that in order to endure this pandemic and future disasters emotionally, it is really important that we work together in our prevention and preparedness efforts and really have confidence ourselves and in our communities that we can actually take real actions to reduce the harmful effects of COVID-19 and other disasters in the future. Specifically, I want to point out that collective vaccination is the only way that vaccines work. And so I think collective efficacy is especially what we need right now. Now, in addition to humans' remarkable capability to be resilient, to bounce back after trauma and stress, we also have the capacity to grow and change in positive ways after a trauma or stressor. This is called post-traumatic growth. And in my research on tornado survivors, we found a number of different ways that individuals grow and change as a result of their experience with tornadoes and the ways that they coped after. So in our studies, survivors said that they experienced spiritual growth. They found they grew closer to other people. They became more open to new possibilities that they hadn't been open to before. They found inner strength that they didn't know they had, or they found that they grew stronger as a result of their experiences. And those who had experienced a direct threat to their life said that they had a deeper appreciation of life after. Now, the abundance of research on resilience and post-traumatic growth shows that it is finding a deeper sense of meaning in life that is so key to having these kinds of positive outcomes after trauma. Now, one of my more recent research studies has found that it isn't just meaning in life in general, but actually our study has supported some of the early ideas that Viktor Frankl had as a result of his experiences searching for meaning when he was imprisoned in Nazi concentration camps. And that is the idea of meaning beyond yourself. Having a sense of purpose, having goals and aims that are focused on the welfare of others, not just your own well-being. And so what my recent research has found is that it is specifically meaning beyond yourself that best predicts resilience, post-traumatic growth, positive outcomes after trauma. We can't get through this pandemic emotionally if we're just looking out for ourselves individually. So the best news I have for you, and the last thing I want to share with you today, is a finding from our studies of weekly surveys of international students during the pandemic. Many of those students were resilient and coping well from the start of the pandemic. But for many of them, their mental health actually improved several months into the pandemic when things were getting worse. So even as COVID cases were rising, even as the lockdown was getting more strict, their symptoms of depression, anxiety, and traumatic stress were actually going down. This was because their symptoms started to decrease once they found more to live for, once they reported increased meaning in life. And so I didn't have that data at the time, but I think this is what I was experiencing back in May 2020, when I found more to live for, and my depression declined, even as the pandemic was getting worse. It's never too late to find meaning in life, so it's never too late to be resilient. Know that your mental health can improve, even as the situation around you stays the same. So if you find yourself currently or in the future in a spiral of depression, anxiety, stress, as a result of a disaster or other stressful circumstance, one of the things that you can do is try to find meaning by doing something that helps the horrible situation that you're in. So right now, be mindful and pay attention to all the pandemic preparedness actions and prevention actions that you're already doing. Do them with purpose, with the aim of helping your community as a whole, not just yourself individually. Because as the people around us, especially in times like this, who make our lives worth living. Thank you.